And I was just making a comment about starting late, that it has the unintended consequence that at the end, people don't get a chance to make their closing remarks. I'm going to use the term take home points, because that's important also, that our panelists get the opportunity to give that one thing that they think is most important. So I'm Dr. Keith C. Ferdinand. I'm a professor of medicine at Tulane University School of Medicine in New Orleans, Louisiana. Tulane is my vehicle. I'm a native of New Orleans. I'm going to go through the panelists. I've met them all, but I'm going to still read it because I want to give everybody their formal titles. Dr. Daphne Pajeaud Ferdinand. She's the executive director of the Healthy Heart Community Prevention Project, also in New Orleans. Dr. Latressa Gordon is director of programs at Michigan United Health in Flint.
It's Oliver, yes.
Close.
Flint, yes.
Oh, you're from Flint,
yes.
Yeah. And Dr. Synovia Moss is the CEO Managing Partners of Moss Consulting and Management Group and National Project Manager for NCNW Good Health. And Dr. Candice Robinson, Director, Scientific Affairs and Public Health, GSK Vaccines. So we have an hour, and we're going to start on time and end on time, but I think it's important for me to make a few comments. United States is in trouble. From a public health point of view, how people work, live, play, and pray, the social determinants of health are going to have a terrible penalty. We already have it in cardiovascular disease. I'm a cardiologist. We thought we had it beat in infectious diseases, but with some of the vaccine hesitancy, mistrust, distrust, misinformation, there have been 800 plus cases of measles. The epicenter was West Texas, but now it's in Ohio. We've had 2 cases in Louisiana. They've even had a couple of cases in Canada, and it's going to spread like wildfire. At least 2 children have died. That's reported, but it's probably more. Diphtheria, which is part of the immunizations that probably everybody in this room got as a child, DPT, whooping cough, sounds funny, but it's not, it kills. And that's probably going to be more cases than we've had in the last 15 years. Oh, by the way, measles was eliminated in the United States in the year 2000, so that just goes to show you. COVID, fortunately, has come down and it's not going away. For those of us who are older or have comorbid conditions, get your boosters, because the viral immunity is not lasting forever. That doesn't mean that the science is bad. It means we're simple human beings with simple tools. We try to help people, and sometimes we have outcomes which will then come back. So COVID's not gone. Polio is now being found in the wastewater throughout most major cities. It's a virus. Again, I see a few older persons in the room. When we were kids, someone would go away from school, come back 6 months later with a withered leg with this big metal braces, or their arm shrunken. That's going to come back. So this panel is very important. If we don't do the appropriate public health interventions, all of these diseases are going to come roaring back. They didn't go away. And from a political point of view, I always struggle because I'm a retired militant, not to get too political. I used to think, how did the Europeans conquer all of these places? How did they kill off the Indians? How did they get rid of the Aztecs? Well, they had muskets. It wasn't a musket. It was infectious diseases. So we're going to start with opening comments. I appreciate your attention. Each of these powerful women have different perspectives, different fields of training and expertise, and we allow their voices to speak. We're going to go from left, right, like that. So I will not stop and introduce yourself. You can say anything you want to say in your own introduction.
Okay. Thank you all, everyone, and good morning. I first want to thank some people, Laura Lee Hall, NMQF, for inviting me to come here and share my story. about what we're doing in New Orleans. We couldn't do this work by ourselves without that support. And Laura Lee, thank you very, very much. So I'm a registered nurse by profession, and I'm the executive director of the Healthy Heart Community Prevention Project in New Orleans, which is a small 501c3 nonprofit organization that does community interventions to help people in our city to reduce their risk for cardiovascular disease by our educational interventional programming. And because this is the type of target audience that we have in New Orleans, flu vaccines became very, very important for us to address with the people who are living with chronic conditions like heart disease, kidney disease, heart failure, diabetes, morbid obesity, and other immune suppressive disorders. For them to get this flu vaccine shot, because if they become infected, what happens? It can exacerbate their conditions, their symptoms, and become sick, and at risk of hospitalization and even death. So we felt it was important for us to be involved in flu vaccinations, although we focus on cardiovascular disease education in our communities with vulnerable people. So what we did as a result of our gracious funding is started in 2022 into 2025 this year. First, starting with flu vaccine events. We held 4 events in different pockets of the city, in pockets of the city that target African Americans. Our flu vaccine rates are extremely low, so we wanted to make sure that we engage partners that support the same vision and mission that we have in improving public health for our residents. So we engaged in various partnerships, and that's key. Whatever you do back home, partner, partner, partner. That's my take-home message for anything that you want to get done within your cities or in your communities, is to engage in those partnerships. And our local health department has been extremely helpful in supporting us, and likewise we support them in the same efforts. We also partner with a local hospital, a local community hospital that in my area that is very community-minded and supportive of those efforts. Walgreens, our pharmacy stakeholder, was also involved. But the other thing, in order for us to have these vaccine sites across the city in our targeted communities, we also needed to partner with our local recreational department, and we didn't have to pay anything to any of them. But what was instrumental with our campaign is a PR firm that we decided to partner with that has spent 40 years in New Orleans doing this type of work. They have developed relationships, trusting relationships with various partners throughout the city. So they were very, very key and instrumental for getting the word out to all of the residents in New Orleans. So we did somewhat like a two-stroke campaign: vaccine sites as well as an educational promotional campaign. And that was in 2022, the later part during the flu season, into 2023 in January when we ended that campaign. But in 2024 and also in January of this year, we decided to take a different twist. We focused strictly on education and promotions, and the PR firm, again, Bright Moments, I love to toot their horn because they're excellent in doing this type of work. They helped us to develop strategies and various messages using social media, television programming, radio streaming on various platforms. We also had digital billboards in 4 different areas within New Orleans that is frequented by a very, very high population area. So we flooded the airways with our 3 trusted messengers, our physicians, who are the face of public health in New Orleans. Yours truly, Dr. Ferdinand. He has been a long-term resident and physician, cardiologist in the city, and it's important to align with physicians and healthcare professionals that have established those trusted relationships within the community. Our local state health department director, Dr. Jennifer Avegno, very community-minded, great stakeholder, It's good to align with your local health departments because that's a part of their job, is supporting the public health efforts within the community. And our other trusted messenger was the CEO of the local community hospital in our area, Dr. Takesha Davis, that does a number of community activities within the hospital itself, bringing people forward to increase their health care status. So we flooded the airways, they made videos, they provided messaging throughout the radio, even into the Spanish-speaking community. Television, we were even on MSNBC. Surprisingly, it was really great to see our doctors delivering these health promotional messages about the benefits of getting the flu vaccine on the airway, even on cable television. Newspaper, targeted areas within our own communities, and it was just a phenomenal campaign. And I can talk a little bit more about the numbers and what we arrived at, but the differences from year to year, later on after everybody else has an opportunity to speak.
All right, thank you. Dr. LG, Michigan.
Yes, Dr. It's a pleasure to be here. I also like to thank Dr. Laura and Chinny for inviting me, and National Minority Quality Forum has been very instrumental and also in our progress. I'm from Michigan United. I'm also a nurse. I'm a U.S. Army veteran. During the COVID pandemic, we started a pilot program with nurse navigators and navigators for the community. And then in 2021, the vaccination for COVID came out. This is where we get to the flu. And so our community was having, and the Flint, it's most predominantly African American and Hispanic population, were having a poor uptake, a lot of vaccine hesitancy. So we developed a program. The community couldn't get them to get vaccinated. So I developed a program where I'll go out to people's homes. So we created access in the community. First of all, building upon that trust became the navigator, providing education on vaccinations, and then setting up different events, providing people with a time to come, a safe space, and they would come up to me, Dr. J, tell me about this vaccination, keeping it real and being transparent about what vaccination is and what vaccinations isn't. So the biggest thing is we already have the historical traumas within our communities, and then also being afraid to take any vaccination. So there was a team also developed partnership with over 35 partners in the Flint community, partner with our local major #1 trauma center, Hurley Medical Center, with Tarnisa Martin. Dr. Hacker was also instrumental. I became partner with the Genesee County Health Department, so I had a dual role with Michigan United that provided me access, 24-hour access to vaccinations. So with this, I was able to do pop-up clinics all the time, not just during regular standard hours. I could do it any times a day. We went to barber shops, beauty shops, churches, clubs, even to people's family reunions. They had invited us there to have education. I'm talking about, packing. This is a mobile clinic. And then for those that were afraid to come out to do the vaccination, we would also do the home visits for those homebound and those that were afraid to come out. So the biggest thing that was created, breaking down the myths, the barriers, and those partnerships, the instrumental partnership was with the Genesee County Health Department by having that access to vaccines that broke down the barriers. So we bridged the gap between the health department and our communities, also fostering trust within those, rebuilding that trust within the health department and our health systems. And then once we got out there, we realized that there's a lot of social determinants of health that need to be addressed. Like, well, Doc, gee, I know about this vaccination, but I don't have food, or my lights are about to get cut off. So then we branched out and becoming more resourceful, providing those resources. But the biggest thing with the vaccine was breaking down the myths and building the trust in the community. And the way they said that I asked them, well, how can we build trust in this community? Me and my other partner, Nurse Tarnisa Martin, they were saying consistency, being visible. Just don't come out in our community for 1 day or 2 days and then, you're gone. So that's the biggest problem with, we developed these wonderful and beautiful programs going out into our communities, but then the sustainability of them, being able to continue these programs and continue that trust. So the biggest thing I take away is, building that trust in the community. I'm a trust. We do what's weekly, but now it's every second Friday of the month. That also continues to provide health resources as far as vaccinations, where our vaccination pop-up sites. We do over 25 to 30 events a month throughout Genesee County and Oakland County and even out into Detroit, providing the resources. So one of the things is you'll come in, they will come talk and ask their questions, and then at the time they're like, okay, we have the vaccination. So we start out with the COVID, then we have flu, and then we brought all vaccinations out. So all ages, and we vaccinate all ages. And the same people that start out with me when I start out with my small pop-up, start out with me and myself and another nurse, every year they follow me and come get their vaccinations. And so we partner with Walgreens, Cloud Pharmacy, and Big Brother Pharmacy, and our local organizations to provide those resources in our community. So biggest thing is trust and access.
Thank you. Dr. Moss.
Well, good morning, and thank you to NMQF for this invitation, because our organizations, we've been partnering together, so this is not new for us. These are consequential times that we are in. And so it takes consequential organizations like yours and like ours to continue to do this work. As you talked about the infrastructure and building trust. If you think about just centering yourself, the Black church, sororities, fraternities, organizations, that's the work that we were able to do in pulling together all of our groups and organizations to do this consequential work, which 5 years ago, COVID called us all to the table. Yes. It made us all stop and do this work together. And we at the National Council of Negro Women, being a 90-year-old organization this year, founded by Dr. Mary McLeod Bethune, with the premise of bringing all of us together. We are an umbrella organization for 37 national women's organizations. So when the National Council comes to the table, you get all of us. We are Black women committed to empowering and advocating and educating people in our community, our families, and making sure that we meet the needs of the time. So during COVID, we at NCNW, we have been doing health, all of our organizations have very strong health platforms, but we had the opportunity to really come into the vaccine space in helping to manage the pandemic. And so with Good Health Women's Organizations, Good Health Wins, that's what we call it, we understood the importance of vaccines to good health, because this wasn't something that the pandemic brought our attention to the matter, but you think about it, we had disparities prior to the pandemic, and so we sat in this work and we were able to forge this coalition together. Good Health Wins is comprised of 40 state and national organizations that help to build vaccine confidence in communities across the U.S. We have been working very hard to make sure that our groups and organizations, we provide many grants to over 1,000 community-based organizations to do this work. And so with Good Health Wins, we do 4 things. We activate the organizations and groups so that they stay committed to doing this work. So it started off with COVID, but we very quickly saw that it's important to talk about COVID, flu, RSV, pneumococcal, but all of the vaccines across the lifespan. And so we wanted to activate our groups to stay in this work. We educate. We have, at the beginning of COVID, we started what was called our community of practice. And we literally, bi-monthly, every first and third Thursday, since the beginning of COVID, have hosted our community of practice sessions. And literally, you all, next week, or May 15th, will be Community of Practice 100. So you talk about community and sustainability. Community of Practice 100, but we are averaging around 1,000 people per call. So we're gonna hit the 100,000 mark. And I would say that our communities are very hungry for information. So we activate, we educate, but we also motivate. We provide not just information that's real and relevant to our groups and organizations, but we also really work hard to continue to motivate them to do this work. So we have things like our certificate training program, where we are looking at making sure that community-based organizations, think about it, they're the real network and the glue that hold a lot of our African-American communities together, or communities and marginalized communities. And so we do this work to make sure that they are informed and educated, but we also celebrate, because you all, we have survived a lot over the last 5 years. And so as we are continuing to do this work, we really want to make sure that people have the information, that they have the opportunity to access the information and to do this work on the ground. So what does it look like on the ground? We currently have 1,084 mini grants that we give out. And so in the work that we've done through the PAVE program and with our industry partners, our goal is to get information and to be that infrastructure of trust. So we are the trusted messengers with trusted information that we can go out and have those conversations at the dinner table, at church, in your civic organizations. And so that's the work that we've been doing a lot. It's just been very exciting to be able to say that this is not new to us and that we have to stay in this space because it is so real and relevant to making sure that our communities stay healthy.
Thank you. Dr. Robinson.
Well, hello. Good morning, everyone. I'm Candice Robinson. First, again, echo my fellow panelists. Thanks you to NMQF for bringing together this panel at this time. So I am a physician, pediatrician by training, and I currently work at GSK, which is a biopharmaceutical company. I work, my role is really in scientific affairs and public health to really kind of amplify the importance of vaccination and prevention across the lifespan and implementation of immunization here in the U.S. Before joining industry a couple of years ago now, I spent 15 years in pediatrics and in public health. So I'm going to take my hats on and off today and talk a bit about public health as well. As a company, we really work to combine our knowledge of the immune system and cutting edge technologies to create new medicines and vaccinations with the purpose of preventing disease. We know that, our population is getting older. Infectious diseases continue to spread. Chronic diseases take such a toll. And so really, we believe the best return on investment in health is prevention before you become ill, if you can prevent an illness. So a few things as well, I think some of the key words I hear resonating across the panel, and you're going to hear me talk about them too, but partnership is so important. We work a lot with medical providers. We work a lot with informational campaigns for the public so that people are aware of what may be recommended for them and have the information they need to feel empowered to talk to their healthcare provider about the vaccinations they may need. And also making sure physicians and providers and your nurses and your pharmacists have the information they need to engage in these conversations with their patients when they come in seeking advice or having questions about what may be recommended for them. So we know, I think the quote has been said before, it's not the vaccine that saves lives, it's vaccination. So how do we move from just having the vaccine to vaccination is the key. And how do we support providers in those conversations? How do we partner with organizations at state or local levels so that they can kind of address issues in their community and support those efforts on the community level? So I think that's a little bit of our role and how we approach it. But I'd say my two key words are prevention and partnership.
Great. So one of the problems with science is that it tends to sit in a vacuum. And although National Minority Quality Forum is certainly interested in policy, you have to be careful when you talk about politics. I'm not being political, I'm being real. New Orleans is a great city. It's one of the main hubs of the African and Afro-Caribbean population. We've been here 300 years. The state is red, even though New Orleans is an international city. Our governor and our so-called Surgeon General said that they will no longer have mass immunization drives. They will no longer make vaccines available to the various cities and parishes. Parishes are our counties. So I'm going to ask Daphne a question about how she's going to overcome that barrier for 2025 fall. And then I'm going to end with a question to you is, how do you get vaccines to an area, not an enlightened area like Michigan, but into an area like Louisiana, where the agencies no longer are going to assist us in these areas. So you can think about how you're going to come back with that, Dr. Robinson. All right, Dr. Daphne. The governor said we ain't going to give y'all no vaccines. How you going to do a flu drive in New Orleans?
Okay, Dr. Keith, we're going to keep fighting. We're going to keep working. We're going to keep advocating. Okay? We're going to build up this spine, right? Okay, be spineful and still fight for the public health of our families, our friends, our neighbors, our communities, our city, and our states. We got to keep moving. Don't ever stop, okay? So misinformation, our local health department director wrote an article on grassroots working around flu vaccines, okay? She encountered an individual who was inundated with misinformation and spent 20 minutes. Now, this is our health department director who we have partnered with over the past 3 years. Great person, community-minded, supportive, works hard to try to address all issues within our city with regards to public health of our residents. She spent 20 minutes with this individual and convinced this person to now get a flu vaccine. She suggested that if we were able to do many town halls around the city, which is quite difficult for this one health department to do, right? That we would be able to get full flu vaccinations to all 400,000 of our residents. So after I read her article, I said, this is something that we should do, Larlee. Okay, all right? We should all come together within our own city confines and partner. Partnership is just so very, very important. We can't do this work by ourselves. It's impossible. You know, no one is an island, okay? Develop the relationships, trusting relationships with people who envision the same mission that you share as well. There are people out there that believe in that, okay? We've done it. Over the past 3 years, we have done some phenomenal work that we are very proud with the relationships that we have developed within our community in New Orleans. Health department is very, very strong. If they are not supportive of you, you go to them and you start the conversation. Have that conversation and talk about what the needs of our residents and the importance of that. Many town halls, I love this idea that our health department director proposed. And this is something that I am suggesting with funders who are in this room to support community organizations who are about this public health work and consider moving forward with providing the education to our residents, because this one health director convinced this one person 20 minutes. Now, she can't spend 20 minutes all throughout her lifetime, you know, with the work that she's doing with single individuals, okay? So it takes a village to come together and work together to accomplish this mission. So this is something that I'm proposing and I would like to work on within our own city, is to get pockets of coalitions within our neighborhoods and start talking about how we can improve the public health of our communities, you know, especially with these flu vaccines. We've made a difference in how we were able to provide our educational and PR promotions. In partnership, we hired the PR firm, but we are in partnership with them. They're not just a contractor. We treat each other like family. We've developed those trusting relationships with one another. And they share the same mission that we have, and we've been sticking with them for the past 3 years. And we will continue to do that because they have done the work within our community already. They have already developed and solidified those relationships with the partners that they have that brought them into the fold with us to support the mission that we have with increasing vaccination rates in New Orleans.
All right.
So partner.
So Dr. Robinson, I gave you a little time to get your armor up. The way we make flu vaccines is we look at the global south. We look at South America, we look at Australia. They're already in their winter. And we look at the strains that they have. The World Health Organization coordinates some of that. The CDC coordinates some of that. And then industry makes the vaccines and then they're distributed. CDC may not be as strong a partner in developing and distributing vaccines or getting the information to the companies. And I've already told you, in Louisiana, you're probably going to hear about this craziness in other cities and other locales. the health directors say they're not going to even participate in this. How are you going to get the vaccines made and distributed?
Yeah, I think you're highlighting a critical issue here, which is access. How do we ensure people have access to prevention and access to vaccines? And we know there are lots of things that are.
She's alarmed about that.
She's alarmed.
Ring the alarm.
And we know there are a lot of potential barriers and lots of access concerns. We know that policies vary by states, right? And so different states have different policies, different landscapes in which to navigate. How do we navigate those? We know that there are still physical access barriers as well. Rural communities, as was talked about in the last session, often have access issues. There can be transportation barriers. There can be lots of barriers. There can also be, there are still federal barriers that we're looking at. For instance, policies that may come up in the future, like adult vaccine safety nets, are still uncertain. We don't know where some of these things are going. And then, of course, misinformation and disinformation is also another source of access issues. And how do we battle with all of that? And I think there's a few things. One, industry can really serve as a partner to our organizations, to our state, to our public health organizations, to local organizations. We're doing this in a few ways. One, first of all, for state issues, we actually help provide kind of information at the state level when there are legislative actions or legislative bills that come up related to vaccines. And so how can we kind of provide the information that is scientifically accurate to get that information out? And then number two, how do we continue to partner with people working at the state level, at the local level, to kind of continue to get vaccines out to the public? And so one thing that GSK has done in recent years is what we call our co-immunity initiative. And that initiative has worked to provide grants to organizations at the state, local level to help those organizations that are working on issues of vaccine access and vaccine equity. And so in the first 2 years of the program, we allocated $3 million in grants to these organizations for these access issues. And in 2024, there were about $2 million allocated, and they're spread over 15 states, 15 local areas, and 15 local organizations. So really, we are focusing on how can industry be that partner to those in the field, those working with communities, those working with legislators, those working with providers, to help address access issues.
So, Dr. Robinson, I'm a nice guy. I have to tell you that because it's going to sound harsh. At some point, you're going to come up for this year coming up, not what was done last year or in 2023. You're going to come up against politicians who don't believe that they should participate in vaccination distribution, information, et cetera. So you don't have to answer that, but when you guys have your internal meetings, be aware that this is real. That they're going to, all the things you said, help and partner, et cetera, they're going to say, no, we don't want your help. We don't want your vaccine, because they consider it poison. And that now goes to my two informatics. I know you're trusted. But the internet, X, Instagram, not as much blue sky, are full of people who have loud voices, which are the opposite of what you're doing. So techniques to overcome misinformation and disinformation, techniques to have a platform, and you do have a big platform, but it's really huge out there. There are whole streams and threads where somebody dies and they'll say, well, I guess he got vaccinated. I don't know if you've ever seen it. It sounds bizarre, but that's what they do. So who wants to go first? How are you going to fight frank misinformation and disinformation?
That's one of the main things that I did when I was out there. I also have a little TikTok that I do videos on.
Yeah, TikTok's another one with that bad stuff on it.
Yes, TikTok videos on educating, I had one person come to me and say that if I get the vaccination, I heard they'll turn you into a butterfly. So
Really?
That's that trusted space I'm talking about, where someone can come to you and I look at them like, oh, so tell me more. So yeah, I was, you'll turn to a butterfly, you'll get a TV in your hand. These are things, people are really afraid. So just having that straight face, like, okay, well, this is actually what the vaccine is, and this is what it isn't. So providing that information, and on, like, say, the platforms that that I use, like TikTok or Instagram, just providing that information. Like, I'll have a fact sheet up of, flu vaccine, COVID vaccine, RSV or HPV vaccination, and just provide the facts. And then they'll interact and they'll send questions in my inbox. Can you tell me more? Where can I get it? What ages is it safe if I'm pregnant? So providing that information is key. And also that health literacy piece, that's disseminate the information and tying in the health literacy. So they'll be, people that get the vaccination, they'll be informed when they go make a choice. So the thing about it is when we're out there, it's like, hey, you better get this vaccine. If you don't get this vaccine, X, Y, and Z is going to happen to you. The thing is providing the information. This is what the vaccination does. It's not a silver bullet. It's not going to stop you, but it will decrease. It will keep you from dying. I love the one campaign. It will take it from wow to mile. So providing those little nicks of things like that nature. But that's the biggest thing is providing that information. Letting people become an advocate for themselves and making their own decisions. So when they will come up, provide that information, disseminate the information, dispel the myths, misinformation, and then allow them to make their own choice if they're going to get vaccinated. So that was the key in our program when we were out there, not saying like, hey, if you don't get the vaccination, X, you're going to fall out of these different things. The vaccination is here, it's a layer of protection, it's proven safe. There are some side effects, and just providing the whole truth, the whole facts, and transparent about the process. But that's the biggest thing that I did.
I know you have a long history in your organization, and you're a valid source, but I'm telling you, it's out there, it's noisy. How are you going to fight that?
We deal with this all the time, and so it's not just trusted faces, but it's trusted spaces, trusted places. So just a true story. So one of our trusted messengers, and again, we have a very broad network. We're about 4 million in our trusted messenger network now, and one of our trusted messengers came back and shared a story with us that she was on a bus stop, she being an elderly African-American woman sitting on a bus stop with 2 young boys. And they were teenagers, and they were talking about the vaccines and some of the myths that they had heard. And she just shared information about, let's have this conversation. So she was willing to take the time to really talk to family, friends, but anyone about good information. And she also shared with them where they could get sources to find it up and look for this information for themselves. And as they were having this conversation, they were all going to the FQHC, headed to the health center. And she went with them after having this conversation and having them look it up, but she went with them to the health center and they both got vaccinated. So it's gonna take just making that commitment and the intentionality of being able to be with our folks and talk to everybody to say, this is not just why, but here's good information. So you have those trusted faces, but also trusted spaces and trusted places. What we've said to our groups and organizations is that this is not a conversation that's a one-off. We have to make this the norm around what is important and why vaccines are important in our community, and what does that really mean to good health. And so as we're having these conversations, but it's everywhere. So whether you're doing a breast cancer walk, whether you're talking about heart health, whether you're doing diabetes, we say layer it onto everything that you're doing, and so now it becomes the norm. And so to answer, I got a solution for you. We have our own Project 2025.
I was just thinking about that.
I'm just saying. We are listening, we just lifted up this year 25 community listening sessions in 25 African American markets across this country. How do we get this out into the community? We have to go out and be in community. And so in 25 cities across the US, we've actually just completed 12. We are going into the community to have a community at the zip code level conversation to talk about, how do you feel about vaccines? How do you feel about health? What challenges are you experiencing? And our goal is not to have the conversation, is to lift up 25 vaccine confidence hubs in communities across the country. As soon as we announced our Project 2025 this year, we automatically, we really have another 50 cities that are ready to go. because people are hungry for information and they want it to be real and they want it to be relevant. And so it is going to take going out into community, but understanding that we are community and we are empowered to really help those who cannot help themselves, and that's giving them good information.
Dr. Robinson, I'm not picking on you, but there's just so much distrust and mistrust. What is GSK going to do to overcome that? For those of you who don't know, in the United States, anywhere from 25,000 to 35,000 people die from influenza. The flu is not just a bad cold, and that includes over 1,000 kids. We're not really sure CDC is going to be that trusted source of information that it used to be to tell people that this is not just a bad cold. So I'm asking you, because you're a pediatrician and because you work with industry that makes this life-saving vaccine, how are you going to overcome that?
Well, I think the studies show that still provider recommendation is the strongest indicator for receiving a vaccine. Having the provider say, I recommend you have this vaccine for this reason is a very strong indicator of vaccine acceptance. And so, we recognize that our role in industry is to provide that information to provider, help that provider feel confident in making that recommendation, and to partner with others. We may not be the voice that people want to hear from. When I was at the public health department in the height of the pandemic, we recognized we may not have been that voice that people wanted to hear from at the time. So finding those trusted messengers, as Dr. Moss has indicated, be that their provider, who they're going to in seeking out their advice, seeking out their recommendations from their provider, be that someone in the community who becomes that trusted face and that trusted voice. That's how we kind of work against the misinformation that's spreading. And making sure providers have the information they need, making sure providers feel confident in these conversations when they receive questions about what they heard on TikTok or about the latest thing they've seen in the media, having them have that information so that they can address those questions will go a long way in helping that as well. But it's something that everybody in this time, everybody in this field, we all have to partner and we all play a role in combating misinformation.
I'm glad you brought that up. I'm a past chair of the Association of Black Cardiologists, and the present chair is in the audience if he's still here, and the president and the CEO are all here. The same patients who die from heart disease, hypertension, diabetes, kidney disease are the people who die from flu. And those of you who deal with children, the same children who get accidents and trauma and suicide die from flu. So if you have the National Forum for Heart Disease and Stroke Prevention, you have the Association of Black Cardiologists, we're going to have to build into our platforms, not just control your blood pressure, get your sugar down, but tell patients the benefit of vaccination, because I'm just not sure CDC is going to help us this year. I don't think I can tell people anymore, go to that cdc.gov and get the information you need for this. So I recognize that industry is a bad word in some people's lexicon, so maybe if you can just support these various national organizations, National Council of Negro Women, et cetera, the Michigan program, and Healthy Heart in New Orleans, in order to get the information out, because people are going to be inundated. It's going to get worse. It's not better. Time does not always equal progress. There's a mic up front. I don't know if it's live. If you have a question for this wonderful panel of dynamic women, feel free to come forward. Dr. Daphne, go, please.
Dr. Ferdinand, one of the things that we're very excited about is that at the council, we say we're better together. And one of the things that we saw during the pandemic and over the last 5 years is, look at what happened when the entire world had to stop and focus on one thing at one time. We got this country to herd immunity. But it is extending and sustaining those relationships that have been so important, and just as we have to work with providers to make sure that they are informing their patients, but we also want to do the patient advocacy part and making sure that patients know to ask every time. Ask, what vaccine do I need, or what am I missing? And so that's some of the work that when we talk about educating the community, is empowering them to take charge of their health care, but also that they have that that shared patient relationship with their doctors as well. And so that's something that we really want to work hard on, is that campaign of empowering the community to know that you can go in and ask questions and advocate for yourself.
Yeah, we're going to have some hard work. You know, when we were kids, getting your MMR shot, no big deal. Go to the pediatrician, get your shot. But now it's a conversation. And unfortunately, so many people are unvaccinated. But what you think, 90% of the people who are getting these measles had not been vaccinated as kids?
Yeah, you know, we've seen that the U.S. in general, there's about $9 billion a year in spending related to vaccine preventable diseases. And 79% of that spending is amongst persons who are not vaccinated. So we know that, you know.
It is hard.
It is a challenge, but we know that the power of prevention, and we know that it's important, particularly as our population ages, to have these conversations. And also to make people aware of, you know, vaccines they may need, but also disease awareness is important. Some people may not know their risks. They may not know what they're at risk for and what may come of if getting that illness, that infectious disease. So all of this education, all of this disease awareness, all of this vaccine education is really important.
At the mic. The mic. Is it live?
Not live,
But go, please.
yeah, I was like, hello? Okay, there we go. Hello, and thank you so much. My name is Shawnee Scott. I'm a physician in the Bronx, New York. I'm also an assistant professor of medicine, and clinically I practice, I might have said this, internal medicine. Thank you for sharing so much of your insights from the programs that you have implemented. Also, I'm also a member of NCNW, Manhattan chapter. I wanted to take a step back to get a little bit more granular about the conversations that a lot of the advocates or champions have. I think one thing that we do seamlessly and don't get a lot, especially as women, especially particularly as Black women, is emotional labor, and where we create safe spaces and have a innate ability to open up safe spaces to discuss things and ideas, and then also to close them in a very nuanced but effective way. When it comes to your thoughts regarding train the trainer, I think as a physician in my own practice, I work in a FQHC, I'm able to do this just naturally, but when trying to export these talents and get other people to champion this and be able to do this type of emotional labor, I'm at a loss on how to maybe come up with a framework for that. Have you thought of that in your work, and what has proven to be successful?
Okay.
Well, I could say for NCNW, the community listening sessions that we're hosting, these are 30 focus groups around the country, and this is something that we absolutely will be able to scale out. One of the things that we're seeing is that, as you say, creating these safe spaces is not making the assumption that the first thing we've got to do is to convene the conversation and be very intentional about it. And in the first 12 that we've committed to, that we've just completed, we've been surprised because the groups get to self-select who they'd like to attend in their communities. And we are noticing that almost 2 to 3 of their 30 people are anti-vaxxers. And, you know, we did one in a particular city, and the anti-vaxxer, the closing comment was that I've never been in a safe space where I could talk about how I feel about this, and that I'm not an anti-vaxxer to stop other people. It's a personal decision and choice that they made. And people in that wide spectrum, they're all dropped in. So some people said, one person who we would say is anti-vax said, I'm needle adversive. I don't want any kind of needle. So, but we have to put them in that category. And so these are lessons learned that we're starting to see, is that we have to create the safe space, but it is important what we do and the value that we bring to this entire conversation. It's the infrastructure. It started off with bringing all of our groups together to talk about vaccines, and we call it Good Health Wins, but it very easily is the same infrastructure that now we're seeing that we have to talk about all of the other issues, the heart disease and hypertension and diabetes, because this is the work that we come with a multiplicity of issues when we talk about health. And so that's something that, you know, can be scaled, having these community conversations, but it is partnerships, it's infrastructure.
So,
Dr. Ferdinand,
yeah, Dr. Daphne.
I'd like to address her question. I wear another hat with regards to public health, and that is co-chair of the Association of Black Cardiologists Community Programs Committee. And we have a train-the-trainer program which focuses on the reduction of cardiovascular disease risk factors. But we also have an additional component as a part of that, which is focusing on vaccine education. And we have advocates all across the country where we include that vaccine component in terms of the benefits, and as well as educating our advocates around this particular topic so that they can go back to their communities, as well as to stimulate, encourage, and educate their community members about the value and importance, not only about cardiovascular disease risk, but also how vaccines can play a role in exacerbating their chronic conditions as well. So it works, because it works within our organization, and we're doing that kind of work.
One more brief comment at the mic.
Yeah, thank you so much. I am Councilmember Latressa Plummer from City of Houston, and so Texas obviously conservative. Unfortunately, we have to mix politics with medicine, which is unfortunate. In the City of Houston, we just lost about $45 million in funding. Our health department is primarily funded by grants, and we've lost those resources. So as someone which is doing this amazing work, so thank you so much, what would you advise local officials in terms of finding resources to be able to continue doing vaccinations in communities? And let me also say that Texas also, we have no Medicare, Medicaid expansion in Texas, and the anti-vaxxer conversation is very apparent.
It is real, and I just think those members of the audience who don't come from those type of areas that we're in don't recognize that there are now governmental leaders who not only are not going to support your efforts, but who are against it. I don't have any easy answers. I think it's going to be pretty tough. And as you know, there is a white-black mortality gap. This is not EDI. This is not social science. We're talking about people being hospitalized and killed. I don't have any easy answers. I don't know what we're going to be doing going forward if our local health departments don't get the funding from the federal sources and the support from the state of Texas or the state of Louisiana. In fact, we just had conversations with our own local health director in New Orleans. She said that she may have to find funds and grants to buy influenza vaccine for the city of New Orleans. Fun city, but a lot of poverty, a lot of people who are not going to be able to get the care they need if we don't get those resources. I don't have any answers. Anyone has answers?
Thank you.
Anyone has any suggestions on how we can get vaccines to these local areas where they're not going to get the funding from the federal sources in the state?
Our local pharmacies, Dr. Ferdinand, we partner with Walgreens as well as CVS, and our local hospital also has a vaccine supply. So we utilize those resources that are available to us, and Walgreens, you know, not to point out just one particular pharmacy partner, because all of the pharmacies were willing to partner. But we decided to work with them because of our relationships with their regional director. So they have been overwhelmingly welcoming with being involved in getting the word out and providing the services to the community that they serve as well.
Likewise, with my community, you have the pharmacies, but they, you know, some of them eat it at cost. But so now when it comes to where they can't, the pharmacies no longer carry that burden to get people vaccinated. But some, right now, they will provide free vaccinations to the community at their own cost. Some of the partners that we work with, like the Clio and Brothers Pharmacy, allow the access.
So we started on time. We're going to end on time, but before we end, I would like each panel member to give what I would call a take-home message, because sometimes people say, that was a really good panel. There's someone that might speak. I don't see you.
Oh, yeah.
Right here, Dr. Ferdinand.
There's lights right in my eyes.
Thank you. Just want to quickly tie together the comments that both Drs. Ferdinand made about it takes a village, and then about governmental information, and then finally the question from the city of Houston. I'm John Clymer with the National Forum. We work with a couple hundred mayors across the country to promote cardiovascular health, and during the pandemic, we expanded that into vaccine confidence, and immunization promotion. We have black, white, brown, yellow, boy, girl, urban, suburban, rural mayors who are all actively involved in this. And Tony Haygood, the mayor of Tuskegee, Alabama, gives, I think, a great example of the effect that mayors have as influencers in their communities when he talks about a gentleman who approached him and said, my family and I had decided, we sat around our kitchen table and we decided not to get the COVID vaccine. But then we saw you, Your Honor, we saw you get your vaccine, and we listened to you talk about the decision process you went through and why you chose to do it. So we had another meeting in our kitchen, and we all decided that we would get vaccinated, which we did. So thank you, Mayor Haygood. And we hear stories like that from all around the country. We will very soon be working on a project with Dr. Fletcher and ABC in Little Rock with Mayor Frank Scott. And mayors have a tremendous amount of influence. It doesn't cost them anything, any dollars to promote it. And finally, the mayor of West Chicago, Illinois, which is a majority-minority community in DuPage County, he organized a clinic that provided free flu immunizations to over 2,500 community members who wouldn't have had access otherwise.
Thank you very much, John. It's a great message.
Yeah.
All right, 1 minute, 2 minute take home. We're gonna start, I started on the left, we're gonna start on the right.
All right. I think the take home is we have to continue to do the work. We have to continue to do the work for vaccination. You know, GSK just announced year 3 of our co-immunity initiative, so we'll be allocating another $2 million to organizations at the state, local level who are working on issues of adult immunization and health equity. We're going to continue, you know, with awareness campaigns. We're going to continue the work, continue with awareness campaigns around vaccination so that people are aware of what they may need, such as our Thrive 50+ campaign, which is a shingles awareness campaign. And we're going to continue to partner. And so GSK is partnering with some integrative health systems like Temple Health on a project around vaccination equity using community health workers to help with patient discussions and navigations. So we have to continue to band together, continue to do the work, and continue to partner with one another because prevention is key.
Dr. Moss?
So I'll end with a quote from our President Emeritus, Dr. Dorothy Irene Height, who was such a hallmark in this community and into our country. She said, if the time is not ripe, you have to ripen the time. And so for us, it's time for us to get involved and to not just activate, educate, motivate, celebrate, but now we have to advocate and really become a hallmark for ourselves to make sure that the resources are there for our communities as needed. And we do that through our partnerships. We just lifted up a National Committee on Vaccine Confidence in which we will create a think tank around how do we continue this work across our demographic groups. And so for us, this is our opportunity to ripen the time.
Dr. LG?
Okay. As you know, we are in trouble. We are in this climate, we are in trouble. And to continue improving vaccine uptake rates, decreasing vaccine hesitancy, we need to act now. We need to partner together, continue to collaborate, find workarounds, different bridges to find these resources for our communities can be vaccinated and remain safe.
And Dr. Daphne?
It's 2025. It's time to get involved in some good trouble.
Yes.
Okay, y'all know y'all heard that. Good trouble
yes.
from that famous
Yes.
man that we miss so much.
Yes.
Advocate, fight, shake it up, deal with this, hit the miseducation at the forefront. Do the work, give back and serve.
So, we have had a very powerful and hopefully stimulating session combating vaccine misinformation and policy turmoil with data and community action from trusted voices. You've heard some powerful trusted voices. We shall now end. Thank you.